everybody. I am Sanya, your host from Skin Wellbeing Team. I am sure all of you must be keeping good health. Today, we are going to discuss about our skin healthy with focus on urticaria or hives, which we or our near and dear ones have encountered at some times in their lives. Urticaria is characterized by round rash on the skin that itch intensely, and it may be due to chemicals in certain food, allergies to certain medications, insect stings, sunlight, and sometimes the cause is unpleasant. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in old age group as well. Urticaria is classified as acute and chronic, but the most important part is to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early admission. In today's digital world, it's a boon or a blessing that we get to hear from an expert dermatologist online about urticaria and its type, how we can prevent it, and the kind of tests which are required for its diagnosis, the right treatment and management approach at a very early relief. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. Rashmi Rastogi. Dr. Rashmi Rastogi is trained at coveted King George Medical College, Lucknow, where she spent around 5 years. She was a consultant at GSVM Medical College, where she practiced for 6 years before moving on to create her own skin specialty center. She is currently director of Fortune Hospital and lead skin specialist at Fortune Hospital, senior consultant and head of Department of Fortune Skin Clinic Laser and Aesthetic Center with assistance of two leading plastic surgeons. She has also a keen interest for various recent cosmetic procedures as thread lift, Botox, fillers, micropigmentation, eyebrow scalp or lips, hydrofacial laser hair reduction, tattoo removal, black doll facial, chemical peels, PRP therapy, vampire facelift, and has offered these services to many satisfied patients. A very warm welcome to Dr. Rashmi Rastogi, and it's a pleasure, Doctor, that we are going to hear about urticaria from you today.
Thank you for giving me this opportunity to speak upon this topic. And I welcome all the people who have joined this session. And I hope by the end of this session, they have more information about urticaria. Whatever is in my knowledge, I will try to update them. At least they do not do some mistakes that they are actually doing. Or if they see some patient of urticaria, they can help him out.
Definitely, doctor. So this session is going to be very informative, and doctor will be talking about urticaria. Doctor, as we are going to talk about urticaria, first of all, we would love that what is basically urticaria. We would love to know that what is urticaria, how we can define it.
Urticaria, it's a new term. Nobody before entering the medical field, I've never heard of this word. In common language, it is called as pitti or thappad. Every region has its own lingo of telling it what is urticaria. Urticaria is a medical term which defines you have red, raised, itchy bumps over your skin, then it is called as urticaria. It might be triggered. There are few triggers that trigger the urticaria. You feel intense scratching sensation. The skin is red and skin is lifted up. Bumps are there. Your skin seems swollen, and if it aggravates, then you can have all your lips and nose and eyes also swollen. This area of periorbital, it becomes also swollen. Your eyelids are they have very less skin. It becomes also swollen. Then we call it as urticaria.
Okay, so as you described that this is particularly urticaria, that means it is clearly visible. If somebody is having urticaria, one can definitely see that this particular thing is urticaria.
Yeah, if you see somebody having scratching and elevated red raised bumps, you can definitely tell him, look, brother, it is urticaria. You need to see a doctor.
Right, and doctor, as you told us that that there are many triggers of urticaria. So if we talk about the causes, Like, what are the main causes of urticaria? Then, and what are the triggers of urticaria? Why does it happen? Because of many reasons. So, what are the causes of urticaria?
Mostly the main cause is a physical urticaria. Urticaria, like some people have it due to exposure to cold. Some people have it due to exposure to sun. Some people have it due to exposure to this heat. Then people have some dietary causes, like somebody has consumed fish, eggs, or soybean or peanuts. They have allergy to it, and it represents on the skin as urticaria. Then we have aquagenic urticaria, which is due to water, exposure to water. People come, they take a bath, and they have urticaria. So this kind of allergy is also there. Then there are some plants that can cause urticaria. There are some medicines that can cause urticaria, and the list goes on. So there are a lot of things that can cause urticaria. It is for you to discover about them, and just be aware of your urticaria, the triggers of urticaria. You have to be very vigilant. You cannot leave it as such. And one more thing, insect bite, insect allergy is also an cause of urticaria.
Okay, so these are the different triggers, or we can say the causes of urticaria. If somebody is eating some seafood, or because we have seen that many times people go to garden, or somewhere out in the grass or in the trees, and then they come and complain that my hand is scratching or itchiness. So these are the different triggers. Doctor,
Two
how
reasons
can
for going in the garden and having scratching and itching. One is due to the plant. They might be allergic to the plants. And secondly, insect bite reaction might have occurred.
right? So how can somebody doctor define it that this particular is urticaria? I need to go to doctor. Sometimes it is like that people self medicate. They go somewhere, they feel like scratching, and somebody suggests them some cream or some kind of medicine. So they self medicate it. How is that good for someone or not?
Like mostly it is good that you do self medication, but at least whenever this episode comes, you at least consult a doctor. They will find out the reason of urticaria. Self medication sometimes is also helpful, because by the time you reach the doctor, the allergy is very much. Either you take a emergency treatment from a qualified doctor, but don't try to self medicate. Maybe you are exposing yourself to the trigger and still taking medicine. It will be of no use. You have to avoid the trigger, then take medicine, and get yourself consulted first. Then it's always an emergency thing. You have to know, be aware that this is some skin allergy. Should see a doctor. Don't self medicate, because by self medicating or by applying creams, it becomes difficult for the doctor to understand what the problem is. So you are masking the effect of the disease. The doctor, if the doctor can see your disease clearly, he will be able to investigate nicely and treat you specifically for that disease.
Right, definitely. So, as doctor said, do not self-medicate if you are having such kind of allergy. Doctor, as you mentioned that allergy, so I really want to ask that is urticaria allergy?
Urticaria is a form of manifestation of allergy in the skin. All the allergies occurring in a body, be it cough, being it any kind of allergy, the skin reaction to any substance or allergy is mediated by the IgE, immunoglobulin E, of E variety, and it is released. And because of this, histamine release is there. It causes allergy. So it is a manifestation of allergy in the skin only. So
Okay. And when we are talking about the causes, we have talked about that what is basically urticaria. Are there any types of urticaria as well?
yeah, there are two bases of defining urticaria. One is depends on the duration and it also we expect a good outcome or a bad outcome, or we have to monitor it strongly. One is by the time duration, we can classify it as an acute urticaria or a chronic urticaria. Acute urticaria is when it lasts only, the episode is just 6 weeks old. If it becomes more than 6 weeks, you are getting recurrent episodes, then we have to monitor it chronically, and we have to give medicine on a regular basis to treat you permanently. Otherwise, it will keep recurring. Once you are having urticaria, it can be keep recurring if you are not getting treated properly. And then we can also classify urticaria according to the allergy, due to the reason of the allergy. Some people, like physical urticaria is there, then there is a this pressure urticaria. Because of pressure, it is there. Then it is due to some medications. It can be due to some medication. Then also there is this papular urticaria due to insect bite reaction. There are many different kinds of urticaria due to drug, or due to something food allergy. You are having urticaria. So we have defined the urticaria into two categories: one depending upon the time duration, and other depending upon the causes of urticaria, the triggering cause of urticaria. Then urticaria can be also classified on the manifestation. Just urticaria is there whenever it is accompanied by the lip swelling or eye swelling, then it is called as angioedema. It is mostly seen in, due to drug reactions. You have seen, might have seen some people which have taken any medicine and they have swollen lips by the end of the day, or when they wake up in the morning. So we can classify urticaria according to it.
Okay, so there are, as you told us, acute, chronic, and angioedema is one thing. If somebody have some kind of food allergy, these are the types of urticaria. We can say classified urticaria. Doctor, is it like that? That acute and chronic urticaria are treated differently, and if, as you mentioned, that if they're not treated well, they can get worse and can come again. So how somebody should classify it that this is acute and this is chronic urticaria, and what are the treatments which are available for both the urticarias?
When we classify it, because we have to decide for the time duration also. When it is acute urticaria, there has to be a recent any invasion or recent reason that has changed. We ask the history of the patient, where he has gone, where new things has he added to his diet, and whatever things like newer things he has done in the past week or past days, whenever this urticaria had come. So we can easily judge the cause of it. Whenever there is chronic urticaria, we have to meticulously plan out to see whatever things he has to start noticing, whatever things, the triggers he has. And these episodes are, how much frequent are these? So on the according to it, we give medications also. Acute urticaria is treated very nicely with small span of medicines only. And then chronic urticaria, which is episodic and it is coming for years or 6 months or like that, then we have to be very vigilant. We have a basic minimum course of therapy. We give antibacterial agents, antiparasitic agents. We have to find out any infections that may be causing a trigger in the allergy. Like everybody is not allergic to peanuts since birth. Now he is having urticaria since whenever he is taking peanuts. So what the change has occurred? He was not having it before. Maybe he is having some infection, so we have to rule out infections also. We have to give anti-parasitic agents also. And the course of the medicine has increased. And when the chronic urticaria is still getting resistant, then we have to escalate it to steroids or methotrexate, other drugs or biologicals, whenever we treat chronic urticaria, if it is not getting treated by simple drugs. In basically, acute urticaria can be treated by simple drugs, and chronic urticaria needs to be monitored fully, and we have to give many drugs to control it.
Okay, so there are treatments which are available for acute and chronic, but do not self-medicate. And as the doctor mentioned, that if you're having any kind of symptoms, go and refer your nearby dermatologist, because it is very important that you treat the urticaria well. And doctor, is it like that? I think you might have also come across some people, if they have seen that urticaria is getting better, they do not take the full medicine dose. How
Yeah.
is that, very important to take the full medical dose of urticaria, as you have mentioned that it can reoccur also. So yes, on that.
Because people, when they start medicating themselves, what happens is they get symptom free. They get relief partly from the symptom, and after 2 or 3 days it again reoccurs. The basic concept is that when the urticaria is occurring, the cells of histamine, that mast cells that release histamine, that release the allergens, they reside inside your skin for at least 6 weeks. When they have once come up in your skin, they will be there for 6 weeks. And if you don't take any anti-allergic, they will create the symptoms again and again. So you will be very worried, and you will be very not symptom free, because recurrence will be coming if you don't take the proper medicine. And properly, when the mast cells have been eradicated from the skin, then only you will get relief from the symptoms.
Right. So full treatment is important. If you are treating an urticaria, do not leave your medicine in middle only. Complete your proper treatment. Doctor, when we are talking about urticaria, we have discussed what is urticaria, the types, symptoms, and the triggers. Is it like that, if someone in public is having urticaria, or some of our friends are having urticaria, and if, it is contagious, is it like that urticaria is contagious?
No, definitely it is not contagious. It is an allergic reaction that your body is showing to some particular reason.
Okay, so it is not contagious. If somebody is having urticaria, we should ask them to, go and consult a dermatologist, not, to stay away from them. It is like that. Okay, and now, doctor, as you have mentioned about the different triggers of urticaria as well, is it true, or is it like that stress can also cause urticaria?
Stress basically will not cause urticaria, but urticaria is itself a very stressful condition. You cannot scratch yourself publicly. It is very bad for a person to scratch publicly. People have an impression that this person is having some very contagious infection or like that. You cannot scratch yourself publicly. And stress caused by waking up, if you have urticaria at night, it comes up, and you have sleepless nights, then it is a stressful factor for you. You don't live a normal life then. But stress itself does not cause urticaria. Stress induced urticaria is there, but the terminology is different. We give him a physical stress that causes urticaria, not mental stress does not cause urticaria.
Okay. And as you told that, urticaria, somebody scratching their hands or wherever the urticaria is it like that if urticaria wasn't at night?
Urticaria was a little bit, there is a reason of worsening at night, because a patient is unoccupied. Your whole attention is on your own body. So if you are having urticaria, mild itching can be tolerated because you are yourself busy all during the day. When you get free, then you are focusing on your body only. First is that reason. And second reason is that the circadian rhythm is there, which at night these good hormones are little less. So you feel this trigger is getting more, you feel the itching is more. So urticaria might worsen at night.
Okay, so
And
urticaria. Yes,
there
yes.
is one more reason. You might be allergic to your bedding or linen, or there are insect bites that are happening during the night time, which you presume as urticaria.
Okay, doctor. And we have discussed about the symptoms, the treatment, the triggers, and our viewers are also here watching this live. It is a very informative session. So we have some questions as well coming from our viewers. Question is here that what are the long-term effects of chronic urticaria if left untreated, and can it lead to other complications as well?
The long-term effect of chronic urticaria is that you might have the permanent skin changes can be there. Like once it is resolved, the skin becomes normal. If every time it is red and inflamed, then the darkening of skin will be there. Then it might worsen also if you leave it untreated. One small patch or one itching in one hand can be on your whole body. It can cover up your whole body every time the trigger is getting stronger and stronger. So if you leave it untreated, the disease will escalate. So and also you will have to find out the trigger also. We do allergy test. So you cannot leave it untreated. And then if there are sometimes you can get into anaphylactic reactions also, where the swelling of the lips is accompanied by the swelling in the trachea also, your windpipe. It can lead to your obstruction of the breath, so it can be life threatening also. So please don't leave it as such. If you are having chronic urticaria, just visit a doctor and get yourself treated.
Right. So, if you are having any symptoms or if you are having chronic urticaria, please treat it well, because as doctor said, it can be life threatening as well. Doctor, there is another question from our viewer coming up here. That's how often should I follow up with you to monitor my urticaria and adjust the treatment plan if needed?
Uh, we generally initially we do get all the tests done, maybe a week or two. We call the patient back, and then we can plan it on a monthly basis. Every month a patient comes, and by 4 month the chronicest urticaria resolves, so nothing to worry. We just you have to give us time. We have to find out where what your cause is. Once it gets treated, then the follow-up visits can be longer. And it might be that you are cured of the disease also, and little bit tolerance always develops with time.
Right. So, uh, is it like that? That a little bit tolerance is there. You have to take proper treatment. Go visit your dermatologist, doctor. As you have mentioned that there are some tests as well. So, what are these lab tests and why are they required?
Like I always told that these lab tests are required to see any infections are there. First, we have to rule out any infections, because urticaria is a manifestation. It can be a manifestation of a trigger of an infection in your body. So even the tooth caries can cause urticaria. So intestine worm infestations or any bacterial infection or any fungal infection in your body can also cause start urticaria. You're not allergic to something, but because of the infection in the body, you start getting allergic to that. So we have to rule out infections. Then we have to measure your allergic tendency, like IgE levels. We get it done. Thyroid is a major cause, so we get the thyroid panel also done. Then you have to see the infection in the urine also. We get the blood test done, we get the urine test done, we get the thyroid test done, and we get the allergy panel done. So these are a few tests, and whenever we cannot still find out, then the higher tests are there. Allergy testing, prick test is there, skin test is there, then radio immuno tests are there, that can we can find out the cause of allergy, and also the how much allergic a person is, the how much strength of allergy is there in its body.
Okay, so these are the tests which are required if you are having, some past histories or some conditions. A dermatologist better know that how to treat it well and when tests are required. Doctor, there is another question from a viewer asking that is there a possibility that my urticaria might resolve on its own over time, or it is likely to be a chronic condition?
tolerance develops, sometimes it does not develop. So get yourself treated for a basic minimum course. Then you can leave it. See the how frequently you are getting the episodes, and slowly the tolerance comes. Slowly you start to adapt all these, and when your mast cells level come down, when your IgE level come down, you might get a little bit better. But don't think that from starting you can, without treatment you can get it. It cannot be done.
Right. So you have to treat it. If you have, a simple symptom also, you have to go and, see your dermatologist because it can become chronic. So you have to treat it well. Doctor, there's another question coming from a viewer that can you provide guidance on when to use oral corticosteroids for urticaria management and the potential risk associated with prolonged use?
Yes, surely when we cannot treat a patient with antihistaminics, conventional antihistaminic, we have to switch on to oral corticosteroids if the patient is getting worse. But because they are good, they get you immediate relief, and even in anaphylactic shocks and anaphylaxis and angioedema, they give a very fast relief. But you cannot use it for a prolonged time. They have their own side effects, like Cushing. You can get fatty body, you can get high blood pressure, you can get high blood sugars, and stretch marks on your body. You can get acne. There are a lot of things associated with steroids. But to my viewers, I am saying this in this platform. It is a good platform to say, don't panic with the steroids. It is like a knife can be used for murder also, and it can be used for chopping vegetables also. It is a good weapon. We let it be in the hands of doctors only. If you start taking knife, on other hand, they will do anything. It should be in the hands of cooks only. So steroids are like that. They are very life saving drugs. Don't get whenever meet many patients that say, उन डॉक्टर साहब ने तो स्टेरॉइड लिख दिया था, हम तो उनकी दवा नहीं करेंगे. नहीं, ऐसा नहीं है. Steroid is a life-saving drug. Sometimes we also need it to cure you and improve your condition dramatically. But don't self-medicate. It is a weapon of doctor. Let it be in our hands only. And we are very well aware of the side effects, and we give it for a safe duration only. And whenever we are expecting that this is not become safe, it is giving side effects, we withdraw the drugs. And there are a lot of options other than steroids that we can give to the patient.
Absolutely. So it is like that if somebody is expert in something, you have to go and refer that only. And that line was absolutely amazing. That a knife can be used for both the things, and a doctor very well know that how to treat you. So do not self medicate, and go visit a doctor because they know what are the better things for you. And doctor. Are there any do's and don't precautions, dietary precautions someone should have if they are having urticaria?
Like, there is no dietary precaution if you know that your urticaria is due to something else other than dietary. But if you are suspecting that something in your diet is causing urticaria, you have to either take out everything from your diet and start adding one by one, so that you can find out where is your allergy lying. Like, if you're allergic to milk, so you can add milk also, and or withdraw milk also. So you can find out that the cause of the allergy was your milk, or like peanuts, like fish or seafood. You can always suspect that this kind of oil is not suiting me, it is causing me urticaria, by either withdrawing it or knowingly adding it. Then you can find out what the cause of urticaria is. Otherwise, there is uh, no way to for a dietary restriction. Only when patients have angioedema or a drug reaction, we try to give them bland diet which is smooth to digest. Because there are ulcers in your mouth and food pipe also, so you have to have a bland diet. Otherwise, there are no dietary restriction. Just be suspicious of your diet. Be suspicious and aware of what you are eating. It might be causing your urticaria, so just be suspicious of that.
Right. So whatever you are eating, if by eating that you develop urticaria, that means you are allergic to it. So please avoid those things which cause this urticaria to you. Doctor, as we are discussing about urticaria, its symptoms, its treatment, any advice you would like to give to all the viewers watching this live?
Just one thing, like urticaria is not is a very distressing condition. You have to get it yourself treated and do the course that is advised by the doctor. Don't skip the course. You take one pill and you will be fine. So you don't leave that as such. You have to take the entire course. And also moisturizers are of a great help. You apply moisturizer after taking bath, it will subside your allergy to a very great extent. So do not be a victim of urticaria. Just you, if you want to prevent yourself from urticaria, let your body be free of infections. You get yourself dewormed every 3 months or 6 months, and apply a moisturizer. Drink lots of water, so that your urinary system is also good. And these are the things that you can do to prevent urticaria.
Okay, so these are the do's and don'ts, and which you can do. Take proper diet. Good health is very necessary for your life as well. Doctor, there are many social media platforms now. They have many that this cream works on urticaria or that particular cream. How and people use it as well. So your take on people using the social media and then taking the medicine, and if the urticaria get worse because of that information.
And like social media platform, everyone is suggesting their recipes and everything is there, but I don't think it is a good thing, because we have spent our entire life on studying the human body, then the skin, then we have become expert. How can our social media, how can you take advice? Your body is very, very precious. Don't take advice from social media person. Get yourself authenticated. That's why, and your body can be different from everybody. So don't take don't get yourself to a prey to anything that is not authentic, that is not secure. Please don't experiment with your body. It's very, very precious, and you might get side effects which cannot be cured. So don't experiment with your body. This is my message. You be aware. You take Google is there, journals are there. Anything other than journals are not authentic. Please don't take their advice as far as possible, unless until it is very necessary.
Right. So your life is precious, your body is precious, so treat it properly and go to refer a dermatologist because they are the expert. Doctor, this was a very informative session for all our viewers as well. Any takeaway message before we end this amazing informative session? Any takeaway message for all the viewers?
Just please take care of your body, and good moisturizer, sunscreen is very important in your daily routine. You just apply this, and sunscreen is also should be a part of your daily routine. A healthy diet and good adequate amount of water can prevent you from many diseases. And one thing more, I am just organizing a camp for the skin patients. If anybody residing in this area, Kanpur, I'll be organizing a camp on 15th of August for all skin patients, and free of cost. They can come to Fortune Skin Clinic and avail our specialty. Thank you. And it was a very nice session with you.
That was good that you are organizing a camp as well. So if somebody is near around watching this video, you can go. And she is a fabulous expert dermatologist. You can go consult, and if you're having any skin disease, you can definitely consult her. Thank you so much, Dr. Rashmi Rastogi, for your valuable time. And it has been a very informative session for our viewers.
Thank you so much.
And now I am also sure that they will use this information to prevent themselves and their near and dear ones. And Urticaria से वो अपने सभी आसपास के लोगों को भी बचाएंगे. And now they know that if, in case if they see any symptoms, they don't have to treat it themselves. They have to go and refer a nearby dermatologist.
Thank you so much. Thank you.
And it is great to hear you, and we really look forward for many more such sessions in the coming time for viewers, Doctor.
Absolutely. I am also looking forward. Thank you for such a nice, informative session. I hope by the end of this session, everybody is a little bit aware, more aware of urticaria. Thank you.
Yes, definitely. Thank you so much, Doctor. And thank you to all the viewers for your excellent participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page that is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all.